Morning. My name is Mike Ramsay, and I'm the CEO of the Patient Safety Movement Foundation. And it's really a great honor to be here this morning talking to the fifth conference of the Collaborative Latin American Forum on Health Quality and Safety in Argentina. So I'm going to share my screen and talk a little bit about what I think healthcare has occurred since COVID. So I think since COVID, where we had a great setback in safety in our hospitals because so many beds were turned into ICU beds, we had nurses and physicians who'd never worked in ICU before taking care of these patients. Now I think COVID's under control and we're back on track, but I think we're back on track with more momentum. So I have an optimistic view of the next 10 years as far as patient safety goes in our healthcare systems. The Patient Safety Movement Foundation's vision is to get to zero preventable patient harm by 2030. And its mission is to disseminate and integrate the actionable evidence-based practices. In other words, the best practices, and cultivate data transparency, because that's the only way we're going to know if we're making improvement, is to have real, accurate data. And we're all humans, and we do respond to data. If my data is not as good as your data, I do something to make it better. So imagine a world where safe care is delivered every time someone seeks medical care. That's where we want to get to. Now, before COVID, medical error was the third leading cause of death in the United States. COVID took that spot. In fact, it increased. It got to number one at one point in the United States. It's now dropped way back. And number three again is medical error. And so we have to make a difference. And the solutions, we have 4 solutions that we think will make a big difference. One is putting in place evidence-based practices. In other words, if we know how to make something safe, like putting a central line in, then why doesn't everybody do it? Rather like the airline industry, they go through checklists every time, and they don't land with their wheels up, they land with the wheels down. And so basic errors should not occur. We need to have accurate data because people will not talk about their incidents of harm, and healthcare systems don't talk about it because they lose good reputations. They can lose financial reimbursement, but we have to have data because that is powerful at making people change their habits. We need payment with aligned incentives. In other words, you get paid for quality of care, not quantity of care. And we need some kind of oversight, rather like a national transportation board, that will look at healthcare and look at major problems that have occurred and come up with solutions. Not a punishing board, an educational board. And I think that's very possible. If we look at the only healthcare system in the United States where we have some data, and it's late data, but that comes from the government source for government-paid healthcare, our Medicare, Medicaid system. And this is overseen by the Inspector General, and they come out with a report every year. And the one that came out last year talks about data that occurred 4 years before. And it's late. Now they're making a real effort to be on time with real-time data because that's what we have to have. But their conclusion was that 1/4 of Medicare patients, 1/4 of Medicare patients experienced harm in October 2018, and things had not changed. And not only that, 43% of the harm events were preventable. And so 25% of Medicare patients is basically 188,000. And of those, half of them, 90,000, 100,000, the harm events were preventable. And of those, over half of the adverse events resulted in the patient's death that was preventable. And when we look back 8 years, there's no change, no improvement. We're still exactly at the same numbers. So we have to do better. And I think I'm optimistic that we will be able to do better, and we'll talk about that. First of all, when we look at the categories of harm that Medicare patients had, they were medication-related as the number one, then patient care, things like pressure injury, totally preventable, venous thromboembolism, totally preventable or treatable, surgical procedure, pneumothorax, excess bleeding, again, much of that preventable, and infection, hospital-acquired infection, whether it's surgical site infection, central line infection, or respiratory infection, a big cause of harm in hospitals. And when we look at events that are not preventable, how do we decide they're not preventable? Well, I think as we get earlier and earlier data, things that we have now decided are not preventable will become preventable. But these are the sort of top 5 rationales, and that is the event occurred even though the best practice was followed. A patient was highly susceptible to this type of event due to poor health. Patient's diagnosis was unusual or complex, making it difficult. Harm was foreseeable, but was considered acceptable given alternatives. And maybe the harm could not have been anticipated with this event and the information available at the time. So I think this is going to be a moving target. And as we get better data, on-time data, things that were considered preventable, not preventable, will become preventable. The solutions, well, Medicare wanted much better data on hospital-acquired conditions, and they want it up to date, on time, and they've made a commitment to do this and increase the number of conditions that they report, expand those safety metrics, and enforce the hospitals to track and monitor patient harm. The Agency for Healthcare Research and Quality, another branch of the government, updated its quality strategic plans, optimized use of quality and safety review systems, and developed evidence-based clinical best practices for more surgical procedures, more medical procedures, more practice procedures, so that you know if you follow the best practice, your chance of preventable harm goes way down. And then identify and develop new strategies to prevent harm. And so keep this as an ongoing challenge. And these were the recommendations to coordinate the efforts of the healthcare system, oversee it, have guidelines, and research into better recommendations. And for the Medicare, let's have event lists, get better data, test metrics to expand these patient safety metrics, and have surveyors develop an interpretive guidance to hospitals in assessing compliance to track and monitor harm. When we look at Leapfrog with much better data, more up-to-date data, you can see that things like basic hospital-acquired infections increased tremendously during the time of COVID. And we're just leveling out this last spring as COVID settled down. But the direction now is getting better. But when we looked at how much the infection ratio increased for central line infections, it was 60%. And I think that's because we had people putting in lines who were not well trained in it, because they had to fill in gaps in the care system because of COVID. Urinary tract infections increased by 19%, and the MRSA standard infection rate increased by 37%. But now they're getting back to where they were, and hopefully they're going to get much better. And some things did improve. And since the fall of 2022 and the spring of 23, as COVID started to settle down, already urinary tract infections have started to improve, and MRSA has improved as well. And all of them will improve because now we have this drive for patient safety. And some hospitals were able to show very quickly that post-pandemic, they had 100% reduction in eclampsia and CAUTI and 72% reduction in MRSA. So with the best practices, evidence-based practices, improvement can occur. So what is not preventable today might be preventable tomorrow. This is by the person who formed the Institute of Healthcare Innovation, Don Berwick. And he's a phenomenal patient safety advocate. When we look at things called trigger tools for electronic records, this is artificial intelligence being applied to the electronic medical record. We can start to pick up all-cause harm events. And once you can detect them real time, you can start to cause a reduction. That data goes back to the healthcare system. Initially, it was several days later. Now it's becoming very timely with physicians, clinicians watching this data real time, and things that were considered not preventable are becoming preventable. So I'm very optimistic that AI, when used properly and correctly, will be a great help to getting accurate data, and we will all respond to accurate data. How do we change culture? Again, I think encourage reporting of drug errors to reduce recurrences without punishment. In other words, institute a just culture for reporting errors so that we all learn from them and we can prevent them. So advocate for culture changes in your healthcare system. Create a high reliability organization, and that comes from the top down. You have to have a culture of safety in your hospital, and you have to have a non-punitive environment, except where there's severe breaches of evidence-based practices, where people are not following the checklists, where it's like the pilot of the plane is not checking the wheels are down when he's landing. That does require some punitive response. But if you're following the evidence-based practices, you're doing what you should do, then it should be non-punitive. It should be just investigated to understand why it happened. So hardwired safety. And there are 5 characteristics of an HRO. You're focused on failure. You pay attention to what the people in the front line say, because these are the people actually doing it. You have to have resilience for once you've got change put in place, you've got to keep that up. And you've got to refer to expertise. So bring experts in to look at a problem where you've had a preventable harm. And this is my hospital in Dallas. And these signs went right around the hospital. And every employee in the hospital had to sign a commitment to reduce patient harm. And we've got now leadership involved in patient safety. From the top down in the United States, we've got leadership. And this is what you want in your country, from the top down, the president of your country leading this desire to quality, safe healthcare. In Britain, the Chancellor of the Exchequer, Jeremy Hunt, has been a great proponent of safe healthcare. President Clinton, 42nd President of the United States, has been with the Patient Safety Movement Foundation now for 10 years. He was with us at our summit meeting just a few weeks ago, again supporting quality and safe healthcare. The World Health Organization has now moved into supporting safe healthcare globally. No one should be harmed while seeking healthcare. That was what the Inspector General, Director General pronounced in May 25th, 2019. And so now globally, there's a great move for patient safety. And Tedros Ghebreyesus is really raising global awareness of medication errors. And September 17th, 2022 was designated as World Patient Safety Day. That was for medication errors they were focused on. This year, 2023, is going to be on patient engagement, a very important side to protecting patients. And improving patient safety is essential to healthcare system resilience and sustainability, and to achieving universal health coverage. So the WHO are right behind this now, which is terrific. So that's why I'm so optimistic we're going to see change. The 72nd World Health Assembly came up with a global action on patient safety. And this included policies for zero patient harm, high reliability systems, safety and clinical processes. And please get online and look at them, read them, and do celebrate Patient Safety Day coming up September 17th again. There's this need for a paradigm shift. And I think this is important. This is what the WHO is saying, that healthcare, when we look at it, it should mean care, not a place of disease, sickness, or sadness, but a place of care, cure, recovery, healing, and happiness. So this is innovation. Can we create this paradigm shift in thinking about healthcare? Can we eliminate all avoidable harm in healthcare? Well, winners don't do different things, they do things differently. So let's institute evidence-based best practices. Let's get transparency and better data. Let's get a national healthcare system safety board, and let's align incentives. That's all we need to do, and we can get patient harm, preventable patient harm, down to zero. Yes, we can. So I was at one meeting and a nurse stood up and said, what we need is a patient safety army. And she's absolutely right. We want everybody involved in healthcare to be in this army to fight preventable patient harm. From patients and patient advocates, healthcare professionals, medtech companies with better monitors, politicians, and a national patient safety board for every country. So together we can create a safer healthcare system with zero preventable harm. So muchas gracias. Thank you so much for inviting me here. Thank you.